Assalamu alaikum everyone. Today we are going to talk about healthcare system in Pakistan and how it works. In the previous video, we looked at how healthcare systems are funded throughout the world and what are the different models of funding. And today we are going to look at how healthcare system in Pakistan works, making use of the previous learning. And then after this video, we will look at the issues affecting healthcare system or inequalities affecting healthcare system as well. So, healthcare system in Pakistan. So, Pakistan, as you know, is a country of with a population of 216.6 million people. We are fifth or sixth populous country in the world, and by 2030, we will surpass Indonesia and will probably become the first or the biggest Muslim country in the world. So, Pakistan is located in South Asia, and we are surrounded by India, Arabian Sea, Iran, Afghanistan, and China. We are divided into various different provinces, which include Khyber Pakhtunkhwa, Gilgit-Baltistan, Punjab, Balochistan, and Sindh. We also have the Azad and Jammu Kashmir area with us, and then we have got federally administered tribal areas and Islamabad capital territory. So these are the different divisions under which the healthcare system or any system in the country works, and there would be slight variation depending on where you are, and therefore it is important to understand the structure of the country. Population growth rate is 2% of the country, and GDP, which is I would want you to have a look at what GDP is. GDP growth rate is gross domestic product. The rate is nearly 1%. It was about 5% in 2018-19, but since COVID and for various other reasons, it has dropped quite low. But there are hopes that it's going to grow up in going forward. So in terms of the healthcare delivery system in Pakistan, it's divided into public and private sector. So these are the two main players who provide healthcare services to people. Within the public sectors, then you also have divisions of services managed by federal government, services managed by provincial government, and then you have got city level or other level services, which are services managed by the local governments into the places. Federal and provincial governments together are responsible for making strategies and health strategy and kind of making an infrastructure of that. Provincial government is responsible for administering the healthcare system, and then you have got the district level management, which is responsible for implementation of services and providing those services to different people. Within the provincial government, then you have got Provincial Department of Health, who, as I said, manages primary, secondary, tertiary care provision into various parts of the country. And within the federal government, you've got Ministry of Defense, different ministries, research institutes, and military hospitals, etc. Within the public sector, again, we talked about federal and provincial government, but then you also have the organizations like, for example, Army and other places there who have their own healthcare provision for the people they serve in. So there are various different models and various different funding systems. Within private sector, there are bigger hospitals, there are individually practicing general practices located at various parts of the country, throughout the country. Actually, these are very independent, and doctors usually work themselves there. There is some malpractices as well, but that's kind of, that's another issue we'll talk about some other time. Then we also have a network of people who are providing healthcare services but may not come under the biomedical model, which includes hakims, homeopaths, NGOs, and traditional healers, etc., and so on and so forth. So that's kind of a general system of the health under which we operate. Now let's have a look at the structure. So as I said, the healthcare structure, we've got a very good infrastructure developed, especially to do with the primary healthcare setup. How it works or how it provides services is another matter, but it's a good system. So we have got about 1,282 hospitals throughout the country, 670 rural health centers, 5,472 basic health units, and 5,743 government dispensaries. All of these organizations are linked with each other, and people, like for example, being seen into the dispensary may be referred to the basic health unit, which will, if not managed, can be referred to rural health center, then taluka hospitals, and then bigger hospitals into the province. With regards to numbers of professionals, here's the number. We've got one doctor for 963 persons on an average. We have got one dentist for 9,413 persons on average, because we've got the total number of dentists that we have got in the country is 24,930. 112,123 registered nurses, which means that there is one nurse for a population of nearly 2,000. And the number of midwives is 41,810, and the lady health visitor is 20,565. And these are the people who provide services of maternal child health to people across the country. Then we also have trained both health attendants and MCH centers, TB centers, and there's other networks of specific disease-related provisions throughout the countries. So in the previous video, we talked about healthcare building blocks, which included leadership and governance, human resource, financing, organization, service delivery, and information and technology. So now let's have a look at Pakistan with regards to these various building blocks. So as I said earlier on, with regards to leadership and government, Ministry of National Regulation and Service is responsible for developing policy and strategy related to health, and federal and provincial government are responsible for administering healthcare services, and district level government is responsible for implementing healthcare services. If we look at the organization and service delivery, it's 2 levels or some 3 levels or 2 levels sometimes you will see. So primary care is a very good network, which is being delivered by dispensaries and basic health units and rural health centers. Secondary care involves a provision through taluka hospital, headquarter hospitals, district headquarter hospitals, and maternal child health centers. And then tertiary care is biggest teaching hospitals or tertiary care hospital available across the country in different places. With regards to financing, we spend very less on health. We spend about 0.5% of GDP on health regularly. 70% of the healthcare services are provided by private sector, and 78% of the population of the country pays for those services through out-of-pocket payments, out-of-pocket model that you've learned a bit earlier on. Then there are NGOs and donor agencies which support a healthcare provision as well. So this is how the system works. With regards to information, there is we suffer with inadequate resources. For example, drugs, instruments, supplies, technologies, information technology or use of information technologies is limited. There is not very good infrastructure developed across the healthcare system, and that affects provision. Health management information system is lacking, which then means the services are not linked up with each other, and people do not really get a continuation of service if they move from one healthcare provider to another, or one healthcare service to another healthcare services. Having said that, there are some good examples of use of information technology, and we are hopefully developing in that sense, but most of that work is done within the private sector and not necessarily in public sector. There are weak processes of certifying and licensing healthcare professionals, which then means that, you know, when I talked about general practice, there is quite a lot of fake practice and quacks and other people who are not registered medical practitioners or registered healthcare providers can also open up their clinics or places and are able to provide services to people. But as I said, there are some advances in e-health, and there are some good examples happening at different places. With regards to human resources, we are one of the countries which suffer some critical shortage of healthcare professionals. Not only the number of healthcare professionals is short, but also the training and continuous professional development and the confidence and competence of the healthcare professionals is lacking as well. We also suffer with brain drain because there is less opportunities within the system in Pakistan, and therefore a lot of our healthcare professionals do go abroad to other country. 80% of the health expenditure on medical products and pharmaceutical is spent. So this is the 80% of the healthcare budget, which was less than 5% or 0.5% anyway. There are 411 registered manufacturing divisions and 30 multinational companies which are working for medicine and other technologies within the country, and they meet about 80% of the country's demand, whereas 20% is taken up from other countries. Drug Regulatory Authority of Pakistan, which is known as DRAP, is responsible for regulating the medicinal products of pharmaceutical industries and other aspects. So that's the kind of a healthcare system in a nutshell, and the issues which are affecting healthcare system. There are various challenges which are affected. So for example, poorly maintained infrastructure, we talked about that earlier on. While we have got a good network of basic health units in rural health centers, district hospitals, and others linking up, but the infrastructure and the provision of human resource into those places and linking up between different institutions is not that great, and therefore it's poorly maintained. Healthcare system and healthcare professions are not always well equipped with the necessary equipment and technology that they need, as we talked about it earlier. There are human workforce related issues, which examples are shortage of the of appropriate people, confidence and competence of the healthcare professionals, which relates to continuous professional development activities and the shortage of it, the job satisfaction because of the lack of labor laws or lack of implementation of labor laws, jobs may not always be safe, especially in the private sectors. People do get exploited or are underpaid and therefore are depressed, and which then has an effect on their job satisfaction as well as their ability to provide services to others. There are many different health inequalities which affect the country, and we'll talk about that in another video. And the funding that we have for healthcare system is very less. So as I said, it's only about 0.5% of GDP, whereas World Health Organization suggests that it should be at least 5% of the GDP on the health. So these are some of the challenges which are affecting healthcare system of the country. Some recommendations to improve healthcare system include that the appropriate funding needs to be provided to different organizations, appropriate human resource management, which includes that making sure that the shortage of the human resource is tackled, as well as the people are given appropriate abilities or appropriate training to increase their confidence and competence on their ability to provide care. There needs to be appropriate allocation of available resources between rural and urban population, because there's quite a lot of disparity between how services are provided in those places. And we need to work on improving the use of modern technology, including e-health and health information management system, which will make it easier for people to access services, for people to have less tests, because one thing, hospitals and organizations would be able to access them on various different systems, which is not happening at the moment. And therefore people, when they transfer from one hospital to the other, they may have to go through the whole thing again of tests and everything else. And that's just one example. There could be plenty of examples otherwise, which you yourself may have seen it as well. So I hope you found this session useful, and please do leave your comments and ask any questions that you have, and I'll try and answer as much as it's possible.